Hi, so this is the third recording for the Wessex Maternity Academy workshops. This is still part of circulation, so talking about when to do an ECG. So when you've done your A to E assessment, you'll have airway, you've got your oxygen and your airway adjunct station, and then for breathing that still carries along that theme. You've had circulation, you should have had your blood results one, and this is how to do an ECG. So if you have a lady that you've assessed and their heart rate is abnormal, so either very slow, bradycardic, or very fast, tachycardic, you may consider doing an ECG for them. So you've got your 3-lead ECGs, which follows the mnemonic of ride your green bike. So you're going to do a red lead at the top here, yellow, and then green down here. Your heart's action potential follows along this way, so it's basically a quick picture of view of your heart's action potential. You'll keep on continuously, but if your doctors are asking you to do a 12-lead ECG, then you're going to need a more detailed picture. So a bit like a CTG, it only picks up what is happening to the heart at that moment in time, but it will look at historical issues as well. So in the 12-lead ECG, it's actually only 10 leads. So you've got 4 limb leads. Again, these pegs have ride your green bike. So I don't know how well you can see that, but you've got a red coloration here. You've got yellow, green, so ride your green, and then bike is your black one, so that's your earthing wire. So you're going to do your red lead here, yellow lead here, green on the ankle, and black on the other ankle. And then you've got 6 chest leads. So, and they are helpfully marked 1 to 6, C1 to 6. So when you're looking for landmarks here, I've just utilised Carey, so apologies for that. So we've got intercostal space. So you're going to look for your clavicle and then feel the space inside there. So that's your first intercostal space, second intercostal space, third intercostal space, and fourth. And you're going to place stickers on here. Just a note about your ECG clips, which I wish I'd been told sooner. You've either got the clips that go with these stickers here. Just be careful to clean this little bit inside, just because it can get quite gunked up with the glue from it. But if you have the old-fashioned type, you can take the clip off. It just literally slides off here, and you can use these ECG leads instead. These are quite handy if you've got someone who's because they don't fall off as easily as the other tabs. So I'm just going to pop that clip back on. So the ECG placement is the thing that everyone always worries about. So when you've counted down, you've got your 4th intercostal space. You're going to put 1 on here. So 1, 2, 3, 4, and then 1 on exactly the opposite side on the 4th intercostal space. Just going to do it a little bit more. So then the next landmark to go for is the midclavicular lines. And I would say this is about the point of their nipple, unless of course they've got very voluptuous breasts, in which case their nipple might be facing down to the side, but luckily we haven't got that here. So you're just going to lift up the breast and pop your next one in the midclavicular space. So that is number 4. Number 3 is placed halfway between number 2 here and number 4 there. And then you're going to landmark for number 6, which is the mid-axillary line. So it's all the way around under here, and you're following the line of the breast. So you've got less tissue, which is causing less interference to the ECG tracing. So that's number 6. And then number 5 is halfway between the 2. So you've got chest lead 1, chest lead 2 in the 4th intercostal space. You've got third one halfway between this and number 4. And then you've got your chest lead number 6 is the mid-axillary line, and number 5 is here. So the key to it is everyone always worries about it, but it's actually normally printed on the top of your ECG machine. So the bit that takes the longest is actually putting all the stickers on rather than the actual recording itself. I'm going to borrow your other eye. Let's do your ECG while we're here. And then just literally clipping these all in place. So the reason it's called a 12-lead ECG is it looks at 12 points of the heart. So you've got these ones looking at the front of your heart, these looking at the inferior part of your heart, and the one under your armpit looking at the back half of the heart. And then that gives it a diagnosis for the doctors to go from. So regardless of us showing you how to do it, you can't actually diagnose from this. It still needs to be a medical professional that is diagnosing from it. And from experience, I would say normally go for the SHO that has just been on a medical placement, or go to the anaesthetist because they have more of an understanding of what's normal and what the normal heart rhythms are. Invariably, you'll get sinus tachycardia or sinus bradycardia, so the heart is beating at a normal rhythm. So the electrical activity is normal, it's just fast or slow. Occasionally, you'll get an irregular looking heartbeat, so atrial fibrillation, and that's probably the second most common, or supraventricular tachycardia, where the heartbeat isn't working quite as effectively as it could do. It's just very fast and it's coming from a different place in the heart than the normal SA node, AV node conduction system. So once, depending on your machine, it should all be set up as to what speed it's recording at. And you're just going to literally put in the lady's details, her hospital number, any pain relief, if she's been on any oxygen, if she's had any medication for her heart, and then you're going to record it. And that is as simple as doing an ECG is. So the reason I haven't said about how you print them off on your machine is because every trust has different machines depending on what they've bought. So as I said, get it then reviewed by the doctors for sign off. And then when you take it off, you're just going to clean all of the clips and leave it ready for use. As always, the leads always get all tangled up. It's normal, by the way. The leads always get tangled up, so try and keep them as you'd like to find the machine yourself the next time. So when you go back into trust, you may have a trust requirement that you do their own ECG training, but this is just to give you an overview of where to take it from and what to do. So I'll just do the sort of topical view. So you've got them all stuck on there. As I said, being safely sort of underneath the breast area can cause a bit of problem, and your leads can fall off. And also women talking or coughing through an ECG, so just ask them to stay as still as they can when you're actually doing the recording. So your next part is the disability and exposure part, which Gemma's going to do. That's the end of the recording for this one.